I was 32 years old at the time, and I had been giving a presentation that morning, and I had, it was kind of an all-day event, and while giving the presentation I started feeling really hot, and I was like sick to my stomach, almost where I had to stop and leave, but I wanted to continue on and get through it and as fast as I could. And I don't remember, I just remember looking at the clock going, okay, if you could just hang on for just a couple more minutes longer, you'll be fine, you can get to your car and go back to work, it'll be fine. We were just kind of sitting there, and I hadn't eaten anything all day, and I still didn't feel well. And we went to bed, and I got up and I couldn't sleep all night. I was pacing back and forth, and I still felt sweaty, and it's almost like the feeling that your body is, your foot falls asleep. My whole body felt like that, and it wasn't just in one area, it was all over. And I'm like, oh, I had a pain in my chest, and it just kept on getting worse and worse. And so I woke her up, and I just said, we gotta go, something's going on here. And right before that I had called my sister, and she's a nurse, and she just said, you're having a heart attack. These are all the signs and symptoms, but she's a new nurse, so I'm like, okay, that's the last thing I think most women think of, and I just put it off. I put it off because I didn't think anything was wrong.
When I tell Sheila's story, I tell people that this is one of the sickest patients I've ever taken care of who survived. You know, the basic premise was that she was not getting blood flow, and we had to do a bypass operation in order to restore blood flow to that portion of her heart. This situation is very unusual. You're right, the vast majority of our patients requiring bypass surgery are several decades older than Sheila was. But that first night, that night of her operation, she was so critically ill that I truly didn't believe she'd survive.
He didn't outright say it. He said that I have a very sick girl. He said it's serious and she's very sick. I'm pretty good at reading body language and reading what was in his eyes, and he didn't have to say it. I knew what he was saying.
He came in, and it was clearly his day off. He had jeans and a white t-shirt on, and he had a sucker in his mouth, and I was like, oh great, who's this guy? And he goes, I'm Dr. Wiechmann, and you're gonna get your butt out of bed today. And I'm like, I don't think so. And he's like, no, I think so. And then I'm like, oh, I'm nicknaming him Cowboy. He was just a wild man. I'm like, you are just out of control. I'm not gonna get out of bed. He goes, you will walk today. And I don't care if it's just 5 feet, you're gonna walk today.
She was amazing. She was so strong and so amazing, and 8 days after the operation actually went home. Sheila's actually become a friend of mine, and so I have seen her. Most recently ran into her in the grocery store, and every time I see Sheila, it just brings a smile to my face, and it brings a smile to my heart, because she's just such an amazing person. Sheila and her husband Kurt are wonderful people. They're good friends of mine, and they just have such a positive impact on our community and me. So it's fantastic.
He's like family.
Yeah, we bump into him every now and then in the store or something, and it's always a handshake and a hug, and asking how we're doing, and you can definitely tell there's something there. And there's a special connection, because this isn't something that we expected ever in our lives that would happen.
You hear about all these stories, and you see them coming through, and you interview all these different people, and you never believe that maybe this guy can one day save my life. I mean, I wasn't thinking that day, but just a big thank you to Dr. Wiechmann and his staff of nurses and everybody else who was there. They were wonderful, and I don't think you can find a better doc than Dr. Wiechmann. He was amazing, it's just like, boy, he's just a little, spitfire, and but he saved my life, and I'm forever grateful for that. So.
Sheila, Kurt, it's really an honor to be a part of this presentation. Thank you for everything you do. Thank you for the people you are. I love you.